How can you manage dyskinesia from levodopa and Parkinson's? Imagine trying to keep a delicate balance on a tightrope while your body keeps shifting. That's often what managing dyskinesia from levodopa feels like for people with Parkinson's disease. Levodopa is a cornerstone treatment that helps control many symptoms, but sometimes it causes involuntary movements called dyskinesia. The good news is there are several evidence-based strategies to help manage this side effect and improve quality of life. One of the main approaches is adjusting how and when you take levodopa. Taking smaller doses more frequently can help prevent the high peaks in dopamine levels that often trigger dyskinesia. Switching from long-acting formulations to immediate-release versions allows for more precise control over dopamine levels, which can reduce erratic movements. Timing doses carefully to avoid large fluctuations in medication levels is also helpful. Sometimes, reducing the total daily dose of levodopa is necessary if dyskinesia becomes severe, but this must be balanced against the risk of worsening Parkinson's symptoms. Adding medications specifically approved to reduce dyskinesia can make a difference. Amantadine, especially in its extended release form called Gocovri, is FDA approved for this purpose. It works by modulating glutamate, a neurotransmitter involved in abnormal movements. Adjusting other medications like MAO-B inhibitors or COMT inhibitors may also help if they contribute to dyskinesia. While some experimental treatments are being explored, such as levodopa or nicotine patches, these are not yet standard options and should only be considered within clinical trials or under medical advice. Advanced drug delivery systems offer another promising approach. Continuous infusion therapies, like Duopa, deliver a steady amount of levodopa directly into the intestine, helping to maintain stable dopamine levels and reduce fluctuations that cause dyskinesia. Similarly, newer formulations like Rytary aim to provide a more consistent releases of medication, which can help limit involuntary movements. For some patients with severe dyskinesia that does not respond well to medication adjustments, surgical options may be considered. Deep brain stimulation involves implanting electrodes in specific brain areas, such as the subthalamic nucleus or globus pallidus. This procedure can significantly reduce dyskinesia by modulating abnormal brain activity and often allows for lower doses of levodopa, decreasing side effects. It's important to remember that managing dyskinesia is a personalized process. Mild involuntary movements may be preferable to the rigidity or immobility caused by reducing medication doses. Every person's experience with Parkinson's disease is unique, and what works for one individual might not be suitable for another. Consulting with a neurologist experienced in Parkinson's disease is essential to develop a tailored plan that balances symptom control with minimizing side effects. In summary, managing levodopa-induced dyskinesia involves a combination of medication adjustments, adding specific drugs like amantadine, exploring advanced delivery systems, and considering surgical options if needed. The goal is to find the right balance that keeps symptoms manageable while reducing involuntary movements, all guided by a healthcare professional. Always seek personalized medical advice to ensure the best approach for your individual needs.